Not easy, I know, but exciting.
All right. Well, it looks like we are streaming on social media now, and we all know how important that is. So I'd like to welcome everyone to our weekly call on the community's COVID response. I'm Yael Cassander, stepping in for the stalwart Chuck Carney. I'm the city's communication director, and I'm here today joined by our usual suspects, including Bloomington Mayor John Hamilton, Monroe County Health Department Administrator Penny Caudle, the Monroe County Board of Commissioners President Julie Thomas. We also have Allison Moore, the Monroe County Emergency Management Director, IU Health South Central Region President Brian Shockney, and IU Assistant Vice President for Strategic Partnerships and IUB COVID Response Unit Lead Kirk White. Thank you all for being here today. We will begin with some presentations from each of our panelists, after which we'll take questions from the press who are attending this call. So thanks so much, everyone, for being here today, and we'll begin with Mayor Hamilton.
Thanks very much, everybody. It's been a very, very busy, extraordinary 10 days. Appreciate being together again. Of course, the Center for Disease Control's announcement of last week, which we just kind of got to digest in time for this meeting last week, the lifting of local orders as of Monday this week. I think Administrator Caudle put it very well when she said it's good to remember how complicated it was getting into this pandemic and dealing with it last spring. It's likely going to be quite complicated getting out of it too. And indeed, it seems to, and I think you put that very well. We appreciate the county's health messages that continue to come out that we are not out of the woods, keep protecting each other, but also recognizing some really important steps worth celebrating. Just sharing quick stats, and one thing I just noted a state stat that I thought I'd share. 5 months ago, the death rate in Indiana was over 100 people per day. That has been cut by more than 90% in the last 5 months. That's the vaccine working and many other things that are happening to remember how important that is and how valuable it is to those who get the vaccine. We have had 407 employees who've applied for the wellness $100 benefit, indicating full vaccination. And this week we had 0 employees test positive. So we're pleased with that. We are retaining at the city level the basic protections of masking and distancing for our employees, basically in the workplace. We're continuing to review that as we go, kind of in the evolution, not revolution, as we evolve through time. We are opening up facilities. For example, a week from tomorrow, the swimming pools, public pools will open. Recall they were closed last year. A week from today, the spray pad at Switchyard Park will open. Our employees will continue their protocols. We will continue to inform the public the importance of continuing to protect each other if you're not vaccinated. The farmers market tomorrow, for example, will be an unlimited number, but we'll continue to encourage the masking. That's a tricky balance, but we'll keep working on that. I want to close with recognition. Amid these positive steps, we know the disease is very real and very much here and still has high stakes. And I know from IU Health, we'll hear numbers about what their experience is. We are not done and out of the woods. And last comment, I just want to particularly thank Indiana University for their very important, courageous, historic step announced this morning. I know Kirk White will give more details about that. I think in many ways that may be the single most important action to help this community recover. Not simple, not easy, perhaps with challenges we would expect, but on behalf of the city, I just want to applaud and thank Indiana University and give great appreciation for this step. Indeed, the collaboration through all the years. So to President McRobbie, to Provost Rubel, and Kirk White, to you as well for all your work and for taking this step to protect our community. I want to express thanks. And back to you, Yael.
Terrific. We'll go next then to Monroe County Health Department Administrator Penny Caudle.
Thank you. And, you know, what a good introduction, Mayor. We certainly have continue to have lots going on and some concerns that remain, and yet good things happening. We continue to get some questions about the lifting of the order and confusion. And as you mentioned, it was confusing last spring and summer when the mandates started, and they're going to continue to be a little bit confusing. So the Board of Health did put out a statement just trying to reiterate recommendations. And so I would say, first and foremost, new CDC guidance is for fully vaccinated individuals. If you are unvaccinated, even though the mandate may have been lifted, you should still be wearing a mask and distancing. So if you don't want to do that, the key step is to make that appointment and be vaccinated. There are places where masks are still required. Federal buildings, state buildings, our testing sites, our vaccine sites, healthcare facilities, schools, public transportation, and I know I'm going to leave something out, but certainly businesses may also require masks if they choose to do so. And we ask that people follow those requirements wherever you're going. And I have to say that I've been observing people over the last week and a half, and people have gotten used to wearing masks. And certainly there are some who, maybe have not worn them at all. They just don't. But for the most part, everybody has put on a mask when they needed to. And what I've been observing is that people, they may get out of their car to go into a facility, they have that mask with them, and when they see the sign that says, please put the mask on, they are doing it. So I'm very pleased, and I ask you to continue to do that. Businesses are continuing to adapt as they look to expand their services again. And again, I'm observing some being very creative, and looking at how can we expand and still keep safety in place. I will also say I've observed some places where I'm a little concerned about how quickly they're moving back, right? And so as patrons, we will have to decide, are we comfortable going into a facility, whether it's retail, food, whether it's just a retail shop, who is acting like this is 2019? Or are they easing back into how they're setting up? Do they still have their tables set 6 feet apart? While it may not be a mandate, it's still certainly a recommendation. It's a safety factor. So we would encourage people to continue to think about those things in that manner. Just because you can put people closer than 6 feet doesn't mean that you should put people closer than 6 feet. So think about those things and see if you can't maybe ease into some of those situations a little bit better. But it is going to be up to us as individuals and as patrons in these facilities. And again, even if it is a department store, it will be up to us to decide if we like how they're handling things or not. Indiana still is under the Executive Order 2112 through the end of May, and that does still include some of the, for instance, the state buildings and school masking and those kinds of things. So just keep that in mind. I know it can be confusing. I do want to focus on vaccine and the fact that the evidence shows that it works. Studies are showing that the vaccines are over 90% effective in the real world setting. So we knew that they had a high effectiveness rating in studies, but we are seeing that hold true in the real world. They are good at preventing mild and severe disease, hospitalizations, and deaths. If fully vaccinated, you are less likely to spread the virus, and growing evidence suggests less likely to have symptomatic infection and be able to transmit it. So those are hopeful things that the data is telling us. Some benefits of vaccination: all 3 vaccines are 99% effective at preventing severe illness and death. Unvaccinated Hoosiers make up 99.3% of COVID cases in Indiana, and that is January to now. Fully vaccinated, if you look at your odds, if you're vaccinated or not, how likely are you to be hospitalized? If you are fully vaccinated, your odds are 1 in 50,394. And if you are unvaccinated, 1 in 525. That's a reason, in my mind, to be vaccinated. There are breakthrough cases, and that is what term we use to talk about people who are fully vaccinated and may still become infected. Breakthrough cases are 0.053% of individuals who are fully vaccinated. So the chances of those breakthrough are very small. They do happen. Of those who need hospital care, it is a fraction of a percent, so less than 1%. So again, we know that breakthrough cases occur. We know that severe disease or need for hospitalization can still occur, but your best prevention for that is to be vaccinated. There is information now on breakthrough cases on the state's dashboard. So if you're interested in that, that is something that you can follow. Monroe County vaccination numbers. As of today, we have 46.8 of our 12 people 12 and over fully vaccinated, and 50.8% have received a first dose. So we continue to see our vaccination rates climb, and we're happy about that. And we encourage you to make sure that you are part of that solution and encouraging everybody you know to be vaccinated. There are lots of opportunities for that. Of course, IU Simon Scott Assembly Hall is a fabulous place to go get that vaccination. We continue to do outreaches. We were in Richland Bean Blossom schools this morning and did about 100 vaccinations. We have staff that will be at Smithville Farmers Market on May 29th from 8 to 12. We will be at the community kitchen. We will be at Ivy Tech on June 3rd. We have lots of other outreaches planned that we will talk to you about in the coming weeks. Even dating apps. I received this morning from Kathy Hewitt, our PIO, and even dating apps are getting into, are you vaccinated or not, as they start to match people up. So whether or not you've been vaccinated is certainly taking over as a conversation piece. Our metrics for this week, we are in a blue advisory. Our positivity rate was 1.47%, and we had 46 cases per 100,000. So we hope that those numbers continue to be in a good positive light. Today, our positivity rate was higher. It was 3.4%. And remember, we've talked about that likely happening because the number of tests that are being done are dropping. So we expect some of that fluctuation, and hopefully that will even out soon. Lastly, I want to talk about our staff and volunteer hours. I've mentioned how grateful we are for not only our staff, but for our volunteers, Medical Reserve Corps, and how we could not do this without them. Our staff, each, the health department and our public health clinic staff have each put in over 1,000 hours at our clinics, at our primary clinics. I'm not talking about their normal work outside of that, just in those vaccine clinics. Our Medical Reserve Corps non-medical people have put in over 2,000 hours of volunteer time. And our Medical Reserve Corps medical folks have put in over 1,800 hours. Our firefighters have put in almost 300 hours. So we are very grateful for these volunteers. These are minimum numbers, so know that they are really putting in more than that, and we could not do this without them. So I will end with a big thank you to staff and volunteers.
Thank you, Penny. That's a lot of numbers, but those are some impressive volunteer numbers. It really has been such a community effort. Thanks for sharing that and that information about vaccinations and how effective they are. We go next to the Monroe County Board of Commissioners President, Julie Thomas.
Hi, everyone. I will start off where Penny left off, which is with thank yous. I'm proud to be wearing my Health EMS shirt today to honor National EMS Week. May 16th to 22nd, the theme Caring for Our Communities, and just a huge thank you from the Board of Commissioners to all of the EMTs and paramedics we have across the county and their hard work that they've done throughout the pandemic and on every other occasion. They are amazing. They respond, they support, and they always care. I do want to add the thanks to the clinic staff, Medical Reserve Corps, all of those volunteers who help make our vaccine clinic so successful. And thank you to Ms. Caudle and the Health Board and Dr. Sharp for organizing everything and keeping us on task. Just a reminder for county residents who may be struggling to pay for basic necessities due to job loss or hours cut. I recommend that you contact your township trustee. We have worked with the county council, Board of Commissioners together have worked on providing township assistance funding, and that funding is from the CARES money. And so contact your trustee. Every resident of the county, no matter where you live, has a township trustee. So please contact them if you are struggling. They are there to help. They have a lot of resources, not just the Township Assistance Fund to offer. We are grateful to IU for their recent decision. I'm sure Mr. White will be talking about that. And also just a quick reminder that to stay on top of any changes in the health order, announcements of open clinics and things like that. Also, emergencies related to weather. Please sign up for the resident alert. It is on the homepage at co.monroe.in.us. Just click through, sign up. You can receive text or email or phone call when there's any emergency and any change to our health order. You can see, for those of you who are active on Resident Alert, you've probably seen some great information being pushed through about the health orders, and that's important for everyone to have access to, however you'd like to do it, whatever's convenient for you. And with that, we'll take questions. Thank you.
Thanks, Julie. We go next to the Monroe County Emergency Management Director, Allison Moore.
Thanks, Lyle. Yeah, I'd like to just piggyback right on what Commissioner Thomas mentioned with it being EMS week. I remember when we first started out in this pandemic early on, we quickly had meetings with them and helped get supplies. And, when everybody was super fearful of COVID and not knowing what to expect or what the next day would bring, they were these fearless individuals that went to these locations and gowned up and masked up and just continue to do their jobs day in and day out. And through this pandemic, they've been amazing. They have definitely shown such great care and passion for our Monroe County residents. So we can't thank them enough for all that they did in the pandemic, as well as what they do every day, day in and day out. We do have 2 blood drives scheduled for May. They are the 24th, which is our daytime drive, and the 27th, which is our evening drive. We also have 2 scheduled in June and 2 scheduled in July. So if that's something that you can, in fact, make a donation for, I would encourage you to hop to our county website at co.monroe.in.us and check the dates, and then hop right over to the redcross.org website and make an appointment, as we are continuing to make them COVID prepared. And so we will continue with the appointments, even though the mask mandate has been lifted. We'll still do that for those safety of those individuals that are willing to make the donations. I would like to just piggyback again on what Commissioner Thomas said and mention that we are continuing as these drives come available, our pop-up tests, our pop-up clinics, or anything that might be new or exciting with our testing sites. Any of that information is sent out via the Everbridge system. So she did inform everybody how to get signed up for that. We do have that also on our local emergency management page on how to get signed up. But if you have any questions with that or need assistance with that, you're always welcome to give our office a call at 812-349-2546. And we are happy to get you signed up or answer any questions that you may have. And that's all I have. I'll take questions at the end. Thanks so much.
Thanks, Allison. We go next to IU Health South Central Region President Brian Shockney.
Thank you, Yale. And yes, it is a happy EMS week to so many. Kelly Mullis, our Director of Emergency Medical Services here in this region, we just thank her and her team for their leadership and all of those who are our first responders. I do remember celebrating and mentioning this week a year ago when we were in the thick of it. And as Allison said, they were those fearless people who led the fight. So thank you all now more than ever. Over the past week, our number of South Central Region COVID-19 inpatients continues to climb, especially at IU Health Bedford. There in Monroe County, between IU Health Bloomington and Monroe Hospital, it's the same story. We continue to see increases in those who are sickest and require inpatient care. I can't express to you enough the key part of the rescinded order was the removal of masks for those that have been fully vaccinated. Our increase in COVID-19 patients is a direct impact of unvaccinated individuals not continuing to wear masks and follow safety protocols. The state of Indiana is currently ranked 41st in the nation as a state for the percent of population that is fully vaccinated. This is about the same ranking we have as a state for health behaviors such as using tobacco products, obesity, and sedentary lifestyles. That means we still have a way to go across our state to truly make an impact in ensuring COVID and other life-threatening diseases are behind us. While we work to increase vaccine rates, please consider to wear your mask when out in public or around people who don't live with you or aren't completely vaccinated. This includes the 2-week waiting period after your last dose. I would also like to note that the recent CDC guidelines around masking for fully vaccinated individuals does not apply to hospitals or healthcare facilities, as Penny Caudle had mentioned earlier. Across IU Health entities, we will continue to require masks for patients, visitors, and team members. Please join us in helping to do our part to keep our community safe. Please, please, please get vaccinated. It is safe. And if you are one of the few that has a mild reaction to the vaccine for 12 to 24 hours, it is a very small inconvenience compared to the toll this virus takes on the healthiest people for a minimum of 2 weeks. IU Health remains committed to doing our part to put COVID behind us by increasing vaccination rates. As I shared last week, we are continuing our focus over the coming weeks on community outreach around vaccines and operationalizing vaccines into our facilities for the longer term future. While our Bloomington site administered their first dose last week, you will continue to see the number of vaccines we report decrease as we are only sharing the numbers for the Paoli and Bloomington community clinics. However, as Kirk has mentioned, they continue to have more and more opportunity for people to get vaccines at Simon Scott Assembly Hall. Through yesterday, we have administered over 86,500 vaccines at the 2 clinics in the South Central region. Please get vaccinated. I will take questions at the end.
Thanks, Brian. And next, the much anticipated announcement from IU Assistant Vice President for Strategic Partnerships and IUB COVID Response Unit Lead, Kirk White.
Well, thanks, Yael. Thanks, everybody, for joining us today. I think, as most everybody knows, Indiana University announced today that we'll be requiring all of our students, faculty, and staff to be vaccinated for COVID-19 by the beginning of the fall semester. So that means that if you have not gotten vaccinated, you need to begin that process by July the 1st so that you can get your second dose in, and that it is fully in effect by the time you'd be arriving on campus in mid-August. We know that the vast majority of our IU community, when they do get vaccinated, this will be the way that we can confidently return to in-person classes and to normal activities and events and have a typical experience for university students. I'd say that over the past year, the university has really taken a very forward approach to mitigating the spread of this pandemic. And it's because of that, because of the strong leadership and our determination to keep our population safe, that we've been able to be recognized as one of the, really in the top 6% of universities for our efforts in testing and maintaining a safe environment. And that's the reason that we've taken this next step. Remember, a person is fully vaccinated for 2 weeks after having all doses of their vaccine, particularly Pfizer and Moderna. Millions of doses have been given. We're up to 34,000 given at Simon Scott Assembly Hall. And the CDC data collected from over 2 million people outside of these clinical trials has not shown any major safety or health issues with the Pfizer or Moderna vaccines. Now, we're going to have an exemption process, but I'm going to have to say that that's going to be a really tight exemption process. It will be for very limited religious reasons or medical reasons. It'll be much more restrictive than our flu vaccine exemptions that we had last year. So this exemption process, there'll be more details about that posted by June the 15th. But just let me say that it's going to be a very restrictive exemption scenario. So you should plan to get vaccinated. Frankly, we're going to take a very restrictive stand on this. If you are not vaccinated as a student, your registration for classes will be canceled and you will not have access to normal campus operations, be it your residence hall or classes or anything else. And the same is true for our employees. This will become a condition of employment for having your vaccine series completed. You know, IU is a leader in health education. And because we are fortunate enough to have the largest medical school in the country, this has given us the expertise to make this decision confidently, to keep the communities that we serve around the state as safe as possible. That has been our goal all throughout this year, and we've been successful doing it. We've been able to keep our communities safe. We've been able to continue campus operations. And though we've been very conservative in how we've approached the vaccine and aggressive in the way that we've attacked it, that's what's kept us in business. And we think will continue to allow us to operate as normal as possible in this coming academic year. We're going to continue to finalize all of the details for the fall restart for 2021. There's still a lot to come out about that, what will be required and how we'll do things for fall starting in the middle of August. We'll get those posted here in the next couple of weeks. Certainly, this vaccine requirement is a big part of our restart processes and procedures that we'll have for the fall. And those will include guidelines for masking, physical distancing, and other activities on the campus. But for the most part, with everyone vaccinated or the majority of our population, we will be back to as normal as possible. And that's where we need to be. I'll be ready for questions. Thank you.
And there are quite a lot of questions coming in after that momentous announcement, Kirk. One of them is coming from Facebook asking how is IU going to verify if students are vaccinated enough, or whether the vaccination card is forged. Is there any specific verification method, or is it just the honor system?
Well, we will be requiring everyone to submit their vaccination documentation by scanning it or taking a picture, and then they'll add it to their one.iu access, which is secure access. And that's how it'll get it entered into the IU administrative system. And then we have a department staffed up that will be verifying these credentials. We do have access to the state database for some of this that we can compare. So there will be aggressive ways that we'll be verifying that these will be done. You know, you're only cheating yourself if you cheat on these cards, and you're cheating everybody around you, and that's not going to get us out of this this international pandemic that we're in. So honesty is going to be an important part of this.
Thanks. And we should reiterate that this expectation will be for students, staff, and faculty, not just students.
That's correct.
Right. So one more for Kirk, and then we'll move on. This one comes from Ethan Burks at WFIU WTIU, who asks about a very specific and beloved event. Given the recent CDC guidelines and nationwide increases in attendance at outdoor sporting events, why are parents and fans still not allowed to watch next week's Little Five race in person?
Well, that's been a very difficult decision for us over really a couple of months ago. And the short answer to that is that we simply could not come up with a verifiable way to, in just a week and a half, really less than a week, about a week, to verify spectator vaccine status in the way that we could organize this and verify safety for everybody. There's also the question about whether we should be encouraging travel from all over the country, knowing that there are some parts of the country that have even less vaccine adherence than we do. And as was mentioned earlier today, we're still in a spot where less than half of the state population is fully vaccinated. So when you look at a scenario like that, and though we had made the decision to go on with the race, which I was really pleased about when we talked about that a couple of months ago, we just were not able to get the logistics in place to be able to manage a ticket process and verification process as we did for commencement to verify that we'd have a safe spectator experience.
All right, thank you. Yeah, we do have quite a few questions here. So let's see. This one is also from Ethan for Penny Caudle. Could you please repeat the percentage of Monroe County that is fully vaccinated?
Certainly, Ethan, and this is of the eligible population. So those 12 years and over, it is 46.8% is fully vaccinated out of that population. And that can be found on the state's dashboard if you want to follow that on a daily basis.
Okay, great. Good to know where those numbers are. So this one is also for Administrator Caudle and Brian Shockney from the B Square Beacon, who asks or states that he's worried about how to count the people in Monroe County who are fully vaccinated. Someone who was counted in the last few months as a vaccinated county resident, but has left town because they graduated from college, will be overcounted. So in the fall, an IU freshman who's not even a resident now is going to arrive as fully vaccinated and will not appear in our county resident count of fully vaccinated people. So they will be undercounted, even though they live here. Looking ahead to the fall, how are we going to try and measure the percentage of people in Monroe County who are vaccinated? Do you follow that?
Dave, you always have the tough questions. But I guess I would say that, you know, right now we're trying to look at how many people not just how many vaccinations are occurring, right? Because we know that people come here for vaccine, but they live in another county. But it really is looking at the general amount of vaccine that's occurring. So if we can focus over the next even few months with really where are we, there are always people who come and go, who move into our community, who move out, and we're going to always have that for any kind of vaccination rate that we're looking at. So it is never going to be an exact science. It's always going to be an estimate. And that's where looking at the county, looking at the state, and looking at the national numbers can make a difference.
Terrific. And I don't know if if Brian has anything to add to that.
No, just a comment that, everyone getting vaccinated, we don't have to worry about who comes into our county or who doesn't come into our county or leaves our county. IU making this step in the right direction for mandatory vaccine is a step in the, it is a step in the right direction. So I think what that does is allows us not to have to worry about that and to really focus on those who are our neighbors and our friends and our relatives, and ensuring that they are safe and well through getting vaccinated.
Thank you. All right, next up, a question from Dave Askins of B Square Beacon for Mayor Hamilton. House Bill 1405 says the state or a local unit can't issue or require a vaccine passport. Even though there's no denying that Bloomington is a local unit, can't the city still require a vaccination for its employees? Because requiring a passport doesn't seem like it's the same thing as requiring the vaccine.
Well, I'll add it to my list of bills I wish had not been passed. That's getting big here, but I will be cautious in saying I'm not the city's lawyer, but you're right, Dave. We agree that Bloomington as an employer, the city of Bloomington as an employer, we believe could require vaccination as a condition of employment. As you know, to date, we've instead pursued an incentive program of the $100 for vaccines, and we're pleased to see now over 400 people doing it. And I think the step by IU to plant the flag out there is really important and perhaps may be significant to other employers. We'll have to look at that, but I believe we agree with your interpretation of that statute, that it does not stop us as an employer from doing that.
Great. All right, next we'll hear from the HT, a question for everyone, or perhaps more directly for Kirk White, from Boris Ladvig, who says that the news release from IU states that faculty and staff who choose not to meet the requirement will no longer be able to be employed by IU. So how is that going to affect tenured professors? What's the timeline as to when employees will be fired if they refuse getting vaccinated?
We're going to give our employees plenty of good time to get this requirement taken care of. We hope that they'll do that and we won't get to this type of situation. But the announcement this morning is very clear that employment at the university is going to be contingent on having this done. And I know there are various regulations and other ways that this could be discussed in terms of grievances and things like that. But the university feels like we have that we can legally require this as a condition of being a student or employee. And so we will follow through on that interpretation.
Thank you. And we have some vaccine FAQs from IU that we can post into social media so that everyone gets those. Vaccine FAQs are up on the IU website. We have more of a general question now from Dave Askins about this call that we've been holding for 14 months or so, who says, how much longer are these Friday press conferences going to continue? And would you be willing to hold them into the indefinite future, but perhaps choose a different non-COVID topic every week that is of multiple jurisdictional interest? Don't all start at once.
Well, I will start. I guess somebody's got to go first, right? It is a good question, Dave. It's one that I know internally we've been talking about, and up until probably last week, we hadn't been getting a lot of questions. And so we will have to rethink about whether or not we need to have these weekly, whether we need to start going every other week, once a month, what have you. And certainly, I think this group would probably be agreeable to doing some in terms of collective topics where they cross jurisdictions. I'm not sure if weekly would be the answer to that or not, but certainly I think your question is one that we're all thinking about and considering. And so knowing that there's interest will certainly play into that discussion.
Mayor Hamilton.
I think that was well answered. We love spending time with each other. As you probably know, we meet off camera, if you will, regularly too, to coordinate, because it's been an exceptional 15 months or whatever. And I do want to thank everybody for the time. These are all busy people. And I think it's been really important to share this health-related news every week. It's a good question. As the health-related news diminishes, God willing, creek don't rise, all this goes well, that will be great if we get to a point where we say, okay, we don't need to do these health things, and then talk about what might be next. I don't know if Brian Shockney is going to want to talk about, whatever, I don't know, fire policies in the city, or Kirk White talk about, the convention center, or who knows, but we'll it's been a pleasure doing this, and let's hope we'll get to a point pretty soon when we can say this isn't needed. That would be fantastic.
I just
I would just add.
Oh, go ahead, Mr. Thomas.
Okay, sorry, I've got a bad internet connection, but I just want to add that, of course, if anything urgent comes up, and as we was heard, we hope this doesn't happen, but we would. It's great that we have this time reserved every week, that if something does happen and we have to do some temporary restrictions or anything like that, that we can communicate that quickly and effectively as a group. And I think it'd be really beneficial that we've got this pattern set up. So thank you.
From the university perspective, what we found is we've had good success because we've been able to communicate regularly and extensively and keep this as transparent as possible. It was a new experience for all of us, and there were new questions that arose every day, particularly as research changed, as CDC guidance changed, as new developments and opportunities occurred, frankly. And so time and again, people have told us that they really appreciate the fact that we've been able to talk about this openly and give the latest details, whether it's the number of people in ICU at the hospital, or whether it's the number of new meals that we can provide for people that were experiencing unemployment, whatever it is, or even on our campus. When can I sit with my friends in the dining hall again? All of those things, when we show that, we've been able to show that we want to get this information out and help everybody get through this. It really has made a difference, I think.
And yeah, I'll just say that the thing that I have been most proud of is the coming together of the resources. Everyone has shared freely the resources, and we've been able to combine our resources to make a significant difference in the lives of our community and the communities around us. And I agree with everything that's been said. Without this, we would not have learned and been able to work together as well. Schedules are always crazy, but as Commissioner Thomas said, this is a time we've all held sacred on our calendars. And I believe that this ability for us to come together and bring the resources to the table for the good of our community is important.
I would just echo that, and I would add that we always try to look for the positive in negative things. And I would say, even though this pandemic has been so hard on our community, it has definitely brought these partners together in a way that we have had to have that sacred time, and the positiveness that has come out of it. No matter what we might face in our future, we have now built those relationships that we will be able to gather this group back together for whatever may come our way. And so I what we may go to, whether it be monthly, bi-weekly, whatever that may be, we will do it in conjunction with all of us together. And then what comes our way, we will be able to pick up those pieces and of course address with the press however we might need to fulfill, so that Monroe is well aware of what's happening. And that we are very fortunate for.
Thank you, Allison. And thanks to all of you for that coordinated response to that question. We are at 2:00 straight up right now. So we will be bidding everyone adieu. I'd like to also thank all of the media representatives who show up in coordinated fashion for this call every week. Thanks to all of you. And this has been this week's call on the community's coordinated response to the COVID pandemic. I'm Cassandra, and next week, the indomitable Chuck Carney will return to your airwaves. Thank you so much for joining us today, and have a great afternoon.
Thanks, everybody. Be well.
Have a good weekend.
Way to go,
Bye-bye.
IU.
Thank you.
Go Hoosiers. Go Hoosiers.